Right, Marcus is here, Joe is here, Ben is here, so I'm going to kick off. My name is Kirsty. It's lovely to see you all. Lovely to meet some of you that I've not met before. I work for the VSF and I am an engagement manager for the health sector. So I'm helping facilitate this call, but I won't be doing any of the speaking, you'll be really glad to know. We've got colleagues from the NHS here, and we've also got Ben from VC, Volunteer Cornwall, who are going to do most of the leading. So I'm going to hand over to Joe and Marcus to introduce yourself, and then Ben to introduce yourself, and then we'll go straight into the slides if that's all right. Any questions anyone's got, please put in the chat, and we will get to them towards the end of the meeting. Okay, Joe, do you want to start? Say hi.
Hi everyone, I think I know a few faces. So I'm Jo Cadman, I'm the West ICA Development Manager, so supporting the West INTs.
Thank you very much. And Marcus, if you're there.
Yeah, hi everyone. I'm Marcus. I'm the Central ICA Development Manager supporting the 6 INTs in Central.
Thank you very much. And Ben, please.
Hi everybody. Half the room here are colleagues, which is really, really lovely. I'm Ben. I'm the Senior Operations Manager with Volunteer Cornwall. And thank you everybody for coming and joining today. This is essentially the first of, well, we're planning for 6 sessions at the minute, 1 a month in the lunch and learn format. I was going to bring my lunch, but then remembered it's spaghetti bolognese and that would be quite messy. So I've not done that. One of the things that we decided would be really, really good is to do this side by side with colleagues from statutory. So with Joe and Marcus today. So this is for our sector. This is for the voluntary sector, and to understand better what our role within neighbourhood health and within the wider integrated neighbourhood teams function is. So any ideas for suggestion and format for the next 5 sessions would be really good. And if anyone's got any knowledge they want to share and would like to present, that would be equally brilliant. Probably worth saying this is completely unrehearsed. Kirsty's going to share some slides, I hope, and be the driver here. And Marcus, Joe and myself will all just talk over each other at the same time.
Great. Shall I try and share them now?
Yes, please, Kirsty. That would be great.
Okay. Give me a indication if and when you can see them. Is that a no? Okay.
Yes.
Yeah, it was on. We're good.
Oh, you can see them. Excellent. Okay.
We can. So,
Great.
yeah, today's session very broadly is an overview, an introduction to what integrated neighbourhood teams are, what our role as a sector is, and a bit more about the wider neighbourhood health agenda. So, what is an integrated neighbourhood team? And Joe, Marcus, please obviously follow up on this, because from a kind of health perspective, in terms of purpose, it's really important that we establish this just now. So INTs, we're not reinventing the wheel here. Lots and lots of us work in a place-based multidisciplinary team alongside colleagues from health, social care, local authority already. We are focusing here, though, on a neighbourhood first approach. So it's joined up. Above all, it's preventative, and it's making sure that people living in a neighbourhood get help earlier and in the places where they live. Joe, Marcus, did you want to comment at all from an NHS perspective?
Yeah, I think it's when we're considering INTs as a place-based team, it doesn't necessarily come in sort of one form. So we might have really good practice already that shows good INT working, where you've got teams out in the community that might already be made up of NHS colleagues, VCSE colleagues, secondary care colleagues already operating as one team. This is a really good example of that. But I think what we're trying to get to is a place where it becomes working practice, where we've already now got across all of our INT steering groups that have got representation from the sort of core stakeholders that we'd expect within each of our communities. So the sort of baseline for that would be making sure you've got the right VCSE representation, depending on what your makeup is locally, primary care, adult social care, CFT, and then any other stakeholders that might feel relevant to that, to supporting that neighbourhood as a sort of overarching group to make sure, yes, we're heading in the right direction with what we're planning with INT working. But you might then have sort of other teams. I mean, proactive frailty is one of the things we're working on at the moment, and that would be a group of people working together as an INT. So it's quite broad scoping.
And for me, it's even bigger than that. So for me, it's a shift and it enabling VCSE partners to drive some of this. So whereas I think often you kind of feel like you're got your begging bowl out for some money, this is an opportunity to go, how can we shift this model completely so that we're driving it from a community aspect? You know your people better than lots of the medical people that will be working with them. So how can you really shift it and start driving that kind of prevention before people even acknowledge that they might be ill? I think it's a really important role that you've got.
Perfect, thank you. So why did the idea come up? What is the problem? Because where there's a solution, there's obviously a problem that comes before it. I suppose I'm going to say it. It's all a bit broken, isn't it? So there is a huge demand, and it's forecast to get bigger and bigger. So the impacts on health and social care is enormous. Within our own collective workforce, there are pressures. We are under-resourced collectively as sectors, and our services are really fragmented in many ways. So we're not talking to each other, or historically haven't always talked to each other in the way that we should be at a very local level, and found common ground in terms of how we work together. And then for our population, there are very obvious inequalities and access issues. So the idea of neighbourhood working in response to that is that all our communities and all of our geographies look quite different. They're made up of very different demographics, and what works somewhere doesn't necessarily correspond to how it works somewhere else. So that was the problem. And where there's a problem, it's important to start discussing in terms of change. So what change would we ideally like? This has to be a very human response to health inequalities, population health, and the way people live and what communities look like. So this needs to be joined up. This needs to involve a very human approach, and it needs to be one where citizens only need to tell their story one time. So by working in an integrated way, whoever receives the message can obviously share that with their team at neighbourhood level. And this is about that shift from treatment, or crisis in this case, to prevention, with better, stronger, safer community connections as well. Anything to add there, Joe, Marcus?
Yeah, I mean, I would just say that I think where VCSE, for me, provides a lot of power in this space is we often, tend to over medicalize a lot within the NHS. A lot of the presentations and people's needs gets presented as a sort of medical thing, whereas we know that, whether you call it building blocks of health or social determinants of health, 80% of people's needs are not medical.
That's right.
So, and yet we tailor a model that an expensive model that points towards a medical, and there's so much work that can be done around our neighbourhoods that can do so much to benefit us around the non-medical space, a more holistic approach to working, and that's where I see VCSE being able to add massive value to support it.
Yeah, that's quite right. I mean, one of the other ways in which that is described in INT forums is shit life syndrome sometimes, and the idea that in later life people are looking at 5 or more comorbidities very much as a result of their social and economic need within their life. So yeah, this is what we're addressing here. Can I have the next slide? Thank you. So this slide is actually from NAPC, National Association of Primary Care, who are the organisation supporting integrated neighbourhood teams and neighbourhood health in Cornwall. This is a really simple formula, the kind of building blocks of what makes a successful INT. And it should really follow this kind of format. So if you find yourself in a room where you are asked, how can we do this best? This is a really good guide. Starting with who is not thriving in our community. Now, in most cases, I would expect colleagues in this room to know that before partners in healthcare. People often present at a GP surgery when it's a bit too late or when something's already happened. We as frontline workers very often have an idea of who those people are who aren't thriving. What's available within our communities. So this is the assets that sit within our community. This is the resources, it's the places, it's the support on offer. What do we have already? What is it that we can build on that already exists? Co-production, this is a really, really important word and something that we'll kind of come back to a few times, I think, through this session. The idea that we are genuinely producing something together across sectors. So most importantly here, you'll see with citizens and partners. So this also involves co-producing a response involving the people that live in our communities. Number 4, developing some achievable specific aims for the next year. We need to have goals. We can't be goalless in doing this. And those aims are going to look really different in different neighbourhoods, as we've already said. Establishing collaborative improvement cycle teams. This is a project that involves change. This is a huge programme of work, and this is a bit of a learning experience as we go along. Some things are going to work and some things aren't. And then number 6, that period of reflection, stepping back together with people who live in our communities, with partners, and kind of expanding on that bit about measurement and learning. And it's a cycle, and it can go round and round and round. And, you know, if we need to track back to the bits that we need to work on, then we can. Kirsty? So we're going to discuss a few bits about what makes successful neighbourhood working. Now, some of that's going to be about our own workforces across our different sectors. But first and foremost, what does success feel like for communities themselves? We are talking about creating communities where it is easier to be healthy and to be well than it is to be sick. Now, that covers a litany of things. That covers town planning. It covers where we put betting shops and fast food outlets. It covers the food that we eat. It covers all sorts of different things. This is about making sure that there is intervention early, using those trusted relationships. And when I talk about trusted relationships, I think straight away about our sector. I think about those people who are known to population, who are known to our communities, our community hubs, our community health and wellbeing workers. It's about what support is available, because support can exist, and if people don't know about it, it's almost irrelevant. And it's about giving people confidence themselves in managing their own health and well-being. So it's not about the NHS telling people, if you come in every year, we'll, you know, if you've got diabetes, come in every year, we'll check your legs, we'll check your eyes. It's about the bit that happens in between. So giving people the confidence and assurance that they can actually manage their own health outcomes as well. What does success feel like for us as staff? So this is about developing our relationships in place with our team. And this is a new team. This isn't a team that's siloed by our organisations. This is a team made up of different sectors, different experience and different knowledge. And what's really important in there is that trust, that shared purpose. So as teams form and teams grow and teams develop, these things are kind of teased out. So what is our shared purpose as a team? What is it that we want to achieve? What are the rules and the dynamics that we need to put into play here? Something fairly fundamental is that there are fewer referrals, you know, paper-based referrals. I know Ray's here somewhere, and at one point had that marvellous project in Penzance with all the flags involving how many referral forms actually exist out there. This is about warm relationships, warm referrals. This is about people having conversations in the same room about individual people. And it's about empathy. It's about clear understanding of what each other's roles look like. Because we all fall into that trap, I think, sometimes, where we say, oh, if only the GP would do that, or if only the social worker would do that. Bureaucracy bunting, quite right, Ray. And I think once we have a better empathy of what one another's roles look like, we become much more effective at working together. And then the thing that's absolutely paramount is the freedom, the permission, the confidence to act in a neighbourhood's best interests. Joe, I see you've just commented as well. I don't know if you want to say it out loud.
I think it's just that whole relationship bit and changing culture. And I think don't think that your voice isn't loud and listened to, because your voice is really important in getting people to think differently. People are stuck in their ways, and it's not necessarily that they're doing things in the right way. It's just what they're used to. So all of that takes this kind of constant message of how can we do this differently? How can we do this better for people?
Yeah.
So be a nag. That's all I'm saying. That's my philosophy.
Yeah. So where does VCSE fit in? It's not really a case of fitting in many ways. Ray, is that a hand up?
Sorry, do you mind if I just, because I think, Joe, that's such a crucial thing, and I just want to underline that as well. Is that okay, Ben? Sorry to interrupt you.
Yeah, of course it is, Ray. Yeah.
So I think that is so important for everyone on this call. It's a change from transactional type relationships that are about, I can offer this thing, do you want to buy it? If you boil it down to its, that's how it's become. It's not by design, but that how it has often become, to a transformational relationship where you're in the room because of your expertise and your thought leadership, as much as the range of stuff that you know about. And that's such an important distinction, and having the confidence and support to see yourself in that role is really, really important. Thank you. I'll shut up now. Probably won't shut up, but I'll try.
Participation is welcome. So anybody else who wants to comment or share a thought, please do. And we're going to expand on that a little bit in a minute anyway, just around the kind of empowerment and confidence that everybody in this room should feel in having these conversations. The knowledge that your expertise is beyond that of others, because it's what you do for a living and because of the care that you put into your roles. I think the starting point here is that the voluntary sector is central to neighbourhood working. It isn't a bolt-on. It isn't a request. It isn't an ask. It's not going to work without the input of the voluntary sector. That knowledge around prevention, what communities look like, how people are connected in their communities, access to peer knowledge and lived experience, and those existing trusting relationships is where we fit in as a sector. The next slide, Kirsty.
Sorry, I was on it and then my mouse disappeared. I just want everyone to know that wasn't, complete incompetence. Thank you.
Kirsty's having a lunch, which is a lunch and learn. Feel free. It's in terms of roles and responsibilities. I mean, just to kind of reiterate a little bit of what Ray's just said there. And I bolted this on actually this morning because I think I started from the wrong place with this. We can list the roles that exist in the voluntary sector, but actually the most important thing is that our role here is strategic. We are co-designing something here. So apologies for all the shouting and the exclamation marks, but I kind of want that to stick. Your opportunity here is to be strategic, and it is to co-design what this looks like. Beyond that, yes, and this is by no means exhaustive at all, it's about connecting to what sits behind that. So the wider VCSE workforce, which includes our health and wellbeing workers operating in areas of highest deprivation, social prescribing, the community gateway, community hubs, the world of discharge and reablement. We're actively getting people out of hospitals and back home and in the places where they live as quickly as possible. And about coordinating a volunteer response as well. So some volunteers obviously sit within community hubs. These people and these places exist already in our neighbourhoods. Shared accountability, so our behaviours within all of this. INTs are accountable for the outcomes of population's health. Now that's big, that's enormous. So in years to come, the health of our populations is really, really dependent on what we do now. preventing, reducing and delaying. So the impact on acute. If we want to make this shift left work, then we need to obviously justify, in really simple terms, money being moved from the places where people are treated. So we need to evidence that this works. And it's about the best use of what we already have in our neighbourhoods. Tanya, I can see that you've commented about climate resilience as well. Do feel free to chime in and mention this.
Thank you. I just wanted to jump in as well and say, you know, the climate resilience team is there and they are funded by the ICB to support every INT around this as well. So there is a dedicated VCSE climate resilience team there to support you across primary care and across the community hubs too. And just in terms of the INTs and the shared accountability, prevention, but health creation as well. So looking at those opportunities around well-fed and other health creation activities that we might want to get involved in.
Yeah. And the correlation very clearly between population health and climate.
Absolutely.
Yeah. Okay, so let's expand a little bit on this notion that we are an equal partner here. What do we know? What experience do we have? We have an abundance of local knowledge. So within our communities where we're working, where our volunteers sit, where our places of community like hubs exist, there's a deep level of knowledge. There are existing trusted community relationships. These have existed for many years now, and we are joining these conversations with that legacy. There's an ability to help people reach statutory services and health that our partners can't necessarily support with. I mean, there are many examples where primary care will send out 2 text messages to ask somebody to come for an appointment, whereas by working, let's say, with a community health and wellbeing worker, and that trusted relationship that helps people become more activated in looking after their own health, makes us very much an equal partner here.
I'd go further than that, Ben, because
go on, Joe.
If I think about some of the conversations I have with people around personalised care and support plans, for example, so it's, well, we're doing personal care and support plans, but they're not. They're doing treatment plans, and actually, you have got different value based. You are more, you will drive that patient activation, you will support people, you will coach people, and I think your role in, don't underestimate your role in that, because people think that they're doing it on behalf of people, but they don't quite get it yet, and I think you guys do. So that's, I think it's really important that you push that.
Yeah, and especially in that kind of individual patient discussion where those what matters to you conversations have taken place, you know, with somebody from our sector. There's a fairly in-depth level of knowledge there, isn't there, about what that person's drivers are, what helps that person become closer to health and healthcare.
You're just a lot warmer, let's be honest.
And it's about strength-based preventative approaches. This is all about not only prevention, but as Tanya's just said as well, about health creation. Prevention's even bigger and better cousin. So yeah, we are creating communities where people can be healthy. In terms of shifting the power dynamic, Joe, I think you used the words begging bowl earlier on, didn't you? We have possibly for quite a long time sort of fallen into the role of being people who are commissioned to, who take referrals, who are a nice addition to have around, you know, if only, Joe, because we are warmer by nature, because that's the kind of work that we do, working in a very nice way, doing very nice projects with communities. And it's about, I think, changing our own mindset and perspective on this as well. We are not referral takers, we are contributors to the design of this. We are contributors and informed people who can help outline within a team what neighbourhood health looks like. We are making decisions and we are leaders in prevention and health creation. Joe, did you want to add anything? Marcus? I'm conscious that this is a little bit the Ben show, sorry.
Can I give you an example?
Be great.
To one of my previous comments around don't underestimate the work, and it goes back to what Joe said around, look, you're basically looking at the individual as a whole, aren't you? Not just as part of what my remit is and having a very boundaried approach, which is typical in our world. But I brought a few different VCSE partners to a GP meeting, and I just said, can you come along and just tell us what you do? And I could watch the jaws drop around the room. The GPs couldn't believe the level of involvement and how thoughtful and thorough it was. Like, I can't believe you offer all of that. And I think that bit, categorizing it as like you're such specialist around that whole person view, and it's a part that's really missing in how we design our services. So going back to that co-design bit, having that perspective in there to say, yeah, that's all well and good, but actually here's the other considerations that we really need to factor into whatever we're designing. So I think it's remembering that it's not about the begging bowl. It's saying we're an equal stakeholder here because we've got a lot of skills, experience and expertise that we can provide you that you don't have and that you need.
Yeah, that's quite right. And I think a good example of that is the type of conversation that happens at the very outset with the community gateway. There will be a presenting need. It might be debt, it might be a single health condition, but what the community gateway would describe as a guided conversation elicits a lot more. It's that whole person, it's holistic, it's everything that's going on and how it interplays with somebody's health. It's really phenomenal. And just to in the chat, Ray's also mentioned about risk and complexity, which is held at community level. I mean, that shouldn't be underestimated. That's a really, really big deal and a really big responsibility. And to have a forum in which that can be discussed and shared is really, really great. This bit about being the expert in the room, you know, we've touched on this quite a lot already, but this is about understanding what lived experience looks like for people, not just a presenting health condition. What works locally, the intricacies and the nuances of different communities and different places where people live, and the activation of different communities as well is really important. That knowledge of what exists already, if we're being efficient about this, we shouldn't be going straight towards money and creating something new. We should be really, really leveraging what already exists, and we have that knowledge. So we know what exists, we know who our colleagues are, we know what places there are, we know what kind of workforce is in our community and what the kind of particular areas of interest are to that community. Equally, knowing what we have is knowing what we don't have. So that knowledge about what the gaps are, what would be good to have, and what people are saying to us. So what communities are saying to us kind of derives what the gaps are as well.
And I think examples of what we're trying to do now is map out what those services are. Penwith, you know, fairly early days in terms of their setup, but you know, I've got the living well stuff, Ray, you'll be pleased to know. You've got a massive sheet here of services that people offer out in the community, but that's not known at all. So how can you be a key part of those teams that feeds that in? Because the knowledge is completely lacking out there. And if they don't know where to point somebody you're not there fully part of that team, how are we going to do that? Because that for me feels like a practical challenge at the moment that we need to work through. Because I know you haven't got loads of resource to kind of go, whoa, we're over here. But I think there's a massive opportunity around engagement, representing views of people, because you get the very true and honest version of stuff. And I think there's then also that signposting bit. So there's such a relationship communication role that we need to work through. What does that look like? I'm a bit waffly there, sorry, but it's a challenge I think we need to work on. Marcus looks like he was going to
add. Yeah. Well, just to say that there's a lot of really good local leaders that can support you as well. I mean, in some of our areas, we've got sort of INT education sessions trying to pull in the wider parts of the system to say, look at all this really good stuff that's happening. So I would say with that sort of practical challenge as well is that don't think that there aren't already a lot of really good relationships out there where you can apply a bit of pressure and say, how can you help us do some of this engagement and get the existing support and resources that are there.
Just before we move on, I just want to comment on a couple of things that have popped up in the chat there. So Ali's mentioned about just having spaces and putting people together. So co-location with colleagues across different sectors. I know that this recurs in INT meetings. How do we convene and how do we get together? So some of that can be found out from the asset mapping bit. What spaces do we have? And across our different sectors, we kind of are amazed at how many places we collectively have that are either underutilized or could be places that we get together in. And that comment about it being transformational is absolutely true. So just being physically next to a colleague from a different sector and having that opportunity to speak in that way is huge. And Sarah's obviously quite rightly said, you know, the focus, because of the nature of this work, is very much on place. But the idea of kind of thematic areas as well, so specific conditions, specific populations, and specific identities is absolutely true. I mean, this might feel a little bit like teaching people to suck eggs, but the ways in which we can feel empowered as a workforce are genuinely about just speaking with confidence about the impact that interventions from the VCSE lead to. So we have an evidence base. We should be using these anecdotal stories, and we should be using our evidence, quantitative and qualitative, to basically share that impact. The question always is, what is the important thing to this neighbourhood? Because the important thing in this neighbourhood is going to be vastly different to the important thing in that neighbourhood. And our job is also to challenge, but we can do that respectfully. You know, we don't need to be stone throwers. We can challenge in a really, really constructive way. If we don't agree with something we're hearing, you have every right as an equal partner to challenge what you're hearing and to say, look, there's a different way, there's a better way. I think this is probably something that Joe and Marcus could comment on as well, just that idea that behaviours and approaches and what's constructive.
I think the identifying different ways is really important, and that just, there is no stupid idea. That the best ideas are the ones that start from a stupid idea, aren't they? And actually we work together and we build it up, and it turns out to be the right solution. But if I think about North Kerrier, that's been going since April, they're kind of actively saying we need VCSE to lead things. They don't really know what they need you to lead, but they want you to come up with ideas. So I think there's a space there for you to fill. It's describing what does that look like from your perspective, and don't be afraid to do that, because you will have allies in the room. Yeah.
So there's something to be said, isn't there, for not walking into a room and saying, what is it you want from us? It's very much, here's what you need to know, or here's what you should be considering.
There is some good practice happening in some areas already, like the Newquay area, where you've got the VCSE collaborative group, which is as many providers as they can get from the voluntary sector coming together, saying what is our purpose, what does our neighbourhood look like, and actually what do we as a group think that our offer should look like. And that's something that we're trying to replicate across more areas, saying actually from a bottom up community base, what should we be feeding in to the to those INT steering groups. So yeah, some of that stuff's already happening.
Yeah, Newquay's a really, really nice example, isn't it? It's like INT squared, kind of that much more of a neighbourhood health approach, as opposed to the constraint of an integrated neighbourhood team as we know it at the minute. Just some practical thoughts around how we can show up as genuine equal partners. attending MDTs or INT meetings as problem solvers. So not as participants, but as active problem solvers. Sharing insights, not just capacity. So it's not just a case of, oh, this is what we're able to do. Taking that approach about the art of the possible. So let's work on the basis that things are possible. What are the insights that we can share about that? Co-producing, co-designing solutions, and building relationships, not just pathways. I mean, pathways as a word is really complex when we talk about people anyway, isn't it? It's not linear. You know, we're kind of zigzagging all over the place when it comes to people. So the bit that's fundamentally important is really, really strong embedded behaviours within your place-based team. So we are getting towards the end. Some takeaways. Integrated neighbourhood teams, neighbourhood health fundamentally needs the voluntary sector to succeed. So keep that in mind. You aren't supplementary here. You're not an addition. You're not a bolt-on. You are essential. And neighbourhood health works best when VCSE leads alongside health and social care. So when we are genuinely stepping into a leadership strategic role, this is when neighbourhood health is going to work at its best. I have put a couple of discussion questions. It would be really, really good if we could open it up a bit. And anyone who's got questions that aren't in the chat, please do just share them. Just shout out or stick a hand up. Kirsty can be the ringleader. But in terms of a kind of few discussion points, I think I want to ask the question is like, what does everybody think in terms of expertise that VCSE can bring to neighbourhood health that nobody else can? So what are our USPs, if you like? Let's take a question at a time. That one first of all.
Okay, I can't see anyone's hands up. Sorry. Shall I stop? I don't want to stop sharing, so I want everyone to see the questions. If you can see hands, Ben, that would help. Or maybe there's no hands.
I can't see any hands.
And
that's okay.
Ray
Ray's
has
got
a
a hand.
hand. Ray, then you go first, and then Jeremy, please.
Well, then you know what I'm going to say, but so this is such a fundamental, huge, and a county-wide shift, and it's all about community, neighbourhood, health creation, whole person. This is our bread and butter, and so you have to bear in mind the table thing. So when asked, what do you sector bring to the table, I feel like you have to have this response in mind. We bring the table, and what we don't want to create, you know, cocky people being argumentative and challenging for the sake of it in meetings, but having that level of confidence of you're talking about shifting to a community focus. We are the facilitators and owners of that community focus. So own it and bring it constructively in a transformational way, not a transactional way.
Thank you, Ray. Jeremy, please.
Yeah, thank you. I think for me, I mean, I'm involved with two INTs, Coastal and Arbenic, and for me, the key thing that I think we've been able to bring to the table as VCSE sector there has been relationships. In that we don't necessarily know what the other things are that we're bringing. So it may be that we've just made those links earlier on, and some way down the line, that relationship is strong enough for people to actively seek out our opinion. To give you some example of that, the mention of MDTs earlier on, I think it shows what a positive shift in terms of culture we've had, in that I was invited to come on to the Arbenic MDT rather than me having to seek that out. And I think that shows how much the sector is valued as a result of a positive cultural change certainly within central ICA. I can't speak for any of the others. And so within that, I think the relationship that I bring, I don't sometimes know what it is I'm going to bring to the table in those MDT meetings, but the fact that I'm there and treated as an equal partner means that I feel that I have that free voice to pipe up and say what I think needs to be said.
Thank you, Jeremy. Ali, please.
Yeah, thank you. I think I just wanted to share that I was having a quite an interesting reaction throughout the course of the presentation to that word, expertise, and even whether that's the right way to frame that question, and whether that's what we're really asking. And the reason why I say that is I think that ultimately the people that we're trying to serve are the experts about themselves. And I think what we want to avoid in rooms and in spaces where we are trying to create equal voices and equal partners is a battle for expertise, and whose expertise is more important than others, and whose experience is more important than others, and whose letters after their name are more important than others. And so I just wanted to share that with the group, that I feel that a question around strengths or assets or unique role or unique perspective perhaps is a better way or a different way of framing what we're ultimately trying to get to. So I just wanted to share that. Thank you.
Thanks, Ali. There's a great question, practical question in the chat here from Joe, probably to Joe Cadman and Marcus, which says, where and when are the times and places for this collaborate strategic work to be done? And are the structures in place now, or how do organisations become involved? So, you know, how are these amazing experts in the sector able to actually contribute at a level where, you know, you are actually connecting with them?
Do you want me to start?
You can start.
Shall I
Go
start?
on.
So we've got Pip in the room, haven't we? So Pip will know that at the moment we're trying to organise a Penrith workshop, which VCSE partners will absolutely be critical, and we're going to send out invites. But I think that's probably driven by each individual INT. Would you agree, Marcus? It feels like there isn't a coordinated county-wide piece apart from the engagement events that Ray and Emma will be invited to, and then Ray and Emma are also part of collaborative group. So that's at kind of a strategic level, but then there is another level within INTs that you've still got that strategic influence. But I don't know. So each of the steering groups has got a VCSE rep. I don't know whether they're necessarily the right person. So you might need to be thinking about, is that person on each of those INT steering groups the right person to represent the whole? And if they are, how are we then going to engage as a range of partners? So I think there's a bit of work for you to do to coordinate yourselves and understand how you can do that together. I think you've got a route in through INTs, but I'm not sure whether it's coordinated enough. Don't know, would you agree, Marcus?
Well, I can speak. So yeah, I was going to think about the different levels, and whether that comes through sort of a higher sort of strategic level as part of the system, or whether it becomes sort of bottom up around opportunities and relationships that are already there. I think specifically thinking about central, I mean, we did a lot of workshops last year incorporating as many of our different representatives from our neighbourhoods in each of our INTs, which I felt gave us a good starting point from a bottom-up perspective. I think this, you know, we are evolving in this space as well. So in terms of that strategic lens, we're still sort of getting around that. We've got engagement events where we're looking at larger system partners around how they're being more involved in neighbourhood health and what their strategies are. But I think as someone who works in the place team around INT working, I feel that myself, Joe, and another colleague of ours in North and East, Danielle, has a strong place around saying, you know, when we're working with different INTs, saying, well, how have you involved VCSE in what you've designed there, and how have you involved adult social care or community nursing, whatever it might be. So it's and then you've got your ICA forums or your West Integrated Board. These are the places where you'll have that same representation. So I think it's just all those different points of engagement. It's trying to see where in your particular role or your particular organisation, at what point do you or where do you access? Because I don't think there's one simple route. I personally love bottom up because that's where you're going to get, the real work done. So if you know that you've got a local INT and you know the population and you've got the relationships, and if you haven't, then you should know who has and how you can link in.
Because it's day-to-day relationships as well, isn't it? So there will be funding applications around new services, and VCSE would be a key partner within that and the development of that. So I think it's about building those relationships and continually having the conversations. And I guess this is helpful as well, isn't it? Because we need your perspective to then affect it. So I think Marcus is right. We're very vocal, and anybody that works in the West will know we're absolutely about driving it from a VCSE perspective. But you can always do more, can't you? I guess.
Thank you very much. Jo, please.
Just sort of coming back, that was my question. So it's sort of the practicalities of it. And I think Homestart are quite a large VCSE. We work across the whole county. We're very well integrated into sort of Cornwall Council networks and social care, but less so into community hubs. And I feel like there's a little bit of a community hubs and older person's care or adult, and certainly family hubs and children's. So I just wanted to sort of give a shout out for ensuring that children's work is thought about when asking about who to invite along, that there's somebody always there. Think baby, think child. Do we have those voluntary sector partners in the room? Because they can have a very different mindset and different thought processes. And I just, shout about early years all the time. I really want sort of people, you get a lot of bang for your buck if you invest in early years, and we're talking about population health. If we can get it right for early years, very often it's right much further through. So I'm really, really keen to be involved. And I know Sarah Phillips, who's here on the call, is keeping us in the loop through VSF about what's happening. But I feel like we're a little bit on the edge of being involved.
I couldn't agree more, Jo. It is absolutely critical. It's the longer term vision, isn't it? It's young people. But I think in fairness, where we started was a bit of a directive around immediate impact around frailty. So now we're starting to have those conversations about, well, actually, how are we then engaging on the children and young people aspect? So Marcus, we've got a new list of priorities, haven't we? So children and young people's is on that priority list, but it's fair to say we haven't really driven from that perspective yet, but it will start now.
No, and I can understand. I know that the immediate, it's about, but if we're moving it to preventative, if that's the overall aim, then I know I'm preaching to the converted, but I think we've got to shift that conversation.
But I think that was my point earlier. We need to keep saying it, because it's only by keep saying it that we actually shift to preventative, because otherwise we know that everybody focuses on the ambulances queuing up outside Trellisk, and that's the immediate visible problem. But that's just a symptom of not getting the prevention bit right, isn't it? So
well, we're just storing up problems
keep saying it.
with the early years for later on, and a huge mental health crisis of children and young people if we don't do the getting in early. Thank you.
There is always a rub with that, isn't there? Because it's worth noting that we are in Cornwall the only system that is putting money into integrated neighbourhood health working. There's no other system in the country that's currently doing it, and we're one of the of 4 vanguard sites across the country around the work that we're committed to. And we have got a bit of a balancing act around the demand in the acute, because that's ultimately where the money's got to come from. So if they're going to be cash releasing to support this work, they're going to want to see something back for it. However, we all recognise the need to do the preventative work, and I think that's starting to come through more and more now, where we recognise that the long-term investment needs to be around children and young people, mental health services, things that we know will prevent the long-term health But it will still be a balancing act. You know, we've got to sort of, you know, it's someone described as you've got to make elephant burgers and not try and tackle the whole elephant. It's a bit of that.
Just in the interest of time, I don't want to cut the conversation short, but I've got about 7 questions, and probably not enough time to get them answered. I've actually got Sarah's question in the chat first, Jeremy. I know your hand is up, but I have got some in there as well. So Sarah, your question is, perhaps, this is probably for Ben and Marcus, I expect. Can you explain the new key model? We've mentioned that in kind of passing the new key model. Can you explain what it means and how it's working?
Yeah, so it sort of came through organically, really, from different VCSE providers in the Newquay area just coming together for a bit of a discussion to say we recognise that, as we've sort of described, that a lot of the funding models around voluntary sector are in piecemeal. You sort of have no long-term commitment around funding and everyone's feeling a lot of the squeeze. So Newquay Orchard, Newquay Food Banks, its Advice Bureau, members of VSF, the whole host of voluntary sector organisations came together and said, can we just meet and talk about actually what are our issues as a provider? What can we do collectively? How can we best share assets and resources? And how can we properly feed into the system with a proper vision and purpose around what our neighbourhood is? Because we've got so much to offer. So they've looked at things like mapping resources. We've had a group come together that goes, can we have a defined purpose for our neighbourhood? So myself and Derek's the place director for Central ICA. We met to say, okay, well let's meet as a group, talk through how we think it can work. And now Charlotte Hill from Newquay Orchard is project leading all the different providers together to say, okay, so we're aware there's funding coming through. Now that we've got a defined purpose, so they've done that work as a whole voluntary sector group. Now, how do we put together a proposal from bottom up using our community knowledge and assets to say this is what we need? So yeah, that's sort of high level view.
Thank you, Marcus. Jeremy, please, you've been waiting. Thank you.
Yeah, I'm quite happy to let others go first because I have spoken before. It was just a quick observation, that's all, which I'm happy to make
Just
another point.
Go ahead, Jeremy, because everyone's voices, you know.
Okay, well, it was just quickly that it was in terms of VCSE involvement within the INTs. I think within Carrick, I've observed that we have 2 different types of involvement with that. I mean, Marcus will tell you that you've got, I think, Lucy and Richard from the VCSE on the Falmouth and Penryn INT group.
And KT Hutchinson as well.
Okay, and they're able to give really good specific Falmouth and Penryn involvement, whereas my role on the other INTs is a bit broader because it's not our Benwick specific, it's not coastal specific, it's broad across the piece. So those are, I think, 2 different types of VCSE involvement, if that makes sense. And I suppose the question is one better than the other, or do we need both?
If it's for us, I think you need both. I think you need to be approached. I think that's why earlier mentioning that bottom up is my preferred approach, because you know your local neighbourhoods, but you need to have that overview as well. So that's where specifically like the ICA forums, where we need to have, you almost want that representation cutting through all the layers when we talk about. We did a bit of a blueprint in Central that says, as a core, we want adult social care, CFT, general practice, VCSE, all as that core group. Well, I think that needs to be consistent through all parts of our system at each strategic level as well. So you've got
so I think the really good thing is that we've already done so much work to get the strategic voice in there. So I completely agree with Marcus. It needs to be bottom down and bottom up and top down. But I think you've already got a really strong voice, which means actually, what if we can now develop some of the bottom up stuff with some real practical solutions, then that's when you really, really get in there as a key partner and as driving it. So what practically can we do differently?
Thank you.
I am going to go. I am going to go now though, because I've nicked a space. So thank you. Lovely to
Thank
see
you,
you
Jo.
all.
Appreciate you
Thanks.
coming. Thank you.
Bye.
We'll try and get through the last couple of questions just before we end, because I'm sure they're all really valid. Becky in the chat has asked, maybe Ben, this might be one you can help answer. Can the INTs connect with the family hubs, as they're also running multi-agency meetings, which cuts down time stresses on our capacity?
Yeah, and actually just thinking about Joe's question or thoughts earlier as well. And Joe, I joined your last alliance, didn't I? And we had that really positive conversation around how community hubs, which you perceive in a certain way, can work with family hubs and other organisations in place. And I think it's just kind of this speaks a lot to our collective responsibility to enhance all of our relationships in place. So as a sector, and with other organisations that are, say, non-health or non-social care, how we build those relationships as well. And you know, maybe we need to do a bit of work around that in terms of our own knowledge base about who our kind of cousins are out there, and how we work together. So it goes back to the same point. It's all incredibly relational. And we have a collective responsibility to kind of keep each other aware, and some reassurance and confidence, hopefully, that colleagues of mine on this call, community makers in particular, working for an agnostic organisation like our own at Volunteer Cornwall, are reflecting the message that you also want to be reflected, and especially when that they have the knowledge base to do that. So yeah.
That's great. A really great question, I think, to round us off here, from Ali, which, Marcus, this is a hot question. How are we going to know if it's working? So at what point are we going to know that we are reducing health inequality, and that are we including those marginalised communities? How are we going to be able to measure that?
Yeah, I think this comes in sort of twofold. Again, I don't think we've got this nailed down. What I would say is, from a system perspective, we've got BI team members, population health data experts that are supporting our work to help us, one, identify a whole range of people and to start doing the evaluation. We've got the National Association of Primary Care that's coming in at the moment with some of our Wave 1 areas that's evaluating some of the early work. That being said, there's not been a whole lot of time in this space, so you know, to expect that we're going to have a massive amount of impact in the short term from my perspective, is a bit unrealistic. I think the second part comes in the form of what do we already know within our existing organisations. We've already got a clear, I mean, if you use the Community Health and Wellbeing Worker Programme as an example, you know, we know where our areas of high deprivation are, we know who we're targeting in that space. And again, if I mention the Nuki collaborative group, they're looking at how do they best share all of the data that they've got to say, well, these are the groups of people that we need to be focusing on. I think when we start looking at the preventative work, you know, when we're looking at children and young people, it's going to take some, you know, a few years before we start seeing actually what is the impact from all of the neighbourhood working that we've managed to achieve within whatever pathway service, whatever has been designed. And it's and also that trusted relationship bit. I mean, it's not just around the, you know, word of mouth referral rather than having to complete a referral form, or, you know, being able to just have the conversation, but actually how are we properly sharing information where it's not all sat in one system and you've got your system over there? How are we, you know, formally sharing information in a trusted way that we've all got that clear overview?
Thank you, Marcus. We're going to come to the end now. I want to just personally thank all of you for joining. I know sometimes things can be a bit meeting heavy, but I know that everyone's been chatting in our own circles around the INTs and what they really mean. So I think getting the ball rolling on bringing us together as a sector, even if it's just for this hour every, you know, few weeks, is going to be really helpful for us all. Absolutely want to thank Marcus and Joe for coming in and I mean, they talk about nothing else, I'm sure, but for our sake, I'm really grateful that you came here and answered some of these questions, and the questions were really great. And obviously a huge thank you to Ben for delivering this. And I just want to ask Ben if you've got anything else to say to the group before I close down this meeting.
No, only to echo. Thank you for your interest, your participation, and thoughts that are really, really helpful. It's a constant learning process, this.
Yeah, and like Ben said, we're going to do a few more of these, and Ray put a bit of a question in the chat around how best do we show up as a sector, and I think that's a really good place to start for us, as a team. What does it actually look like for each other to support each other? We're not in competition. We're not bidding for money for a change. We're going to just try and make sure that we show up as a collective. So, I think we've got a great opportunity. So, thank you again from me and from everybody else that helped facilitate today, and hopefully we'll see you again on the next one. Okay, bye everyone.
Thanks, bye.